Dr. Bill Adams here, No Spin Live, and do we have a show for you today? We're going to be talking about the dancing surgeon and fatal consequences for a patient, how to not make mistakes picking a plastic surgeon, and we'll finish up with booty facials. It's going to be a great show, and we've got some world's experts to share insights with you. We've got Dr. Dan Delvecchio from Boston, Massachusetts, although he's coming to us from London, DDV. We got Dr. Pat McGuire from St. Louis. We've got Dr. Mark Epstein from Long Island in New York City. And then we finally got Dr. Jason Posner from Boca Raton, Florida. So guys, this first story is a sad story. It just recently came out. There's been literally, I've seen 50 articles on this, but the one article that was I sent out to you guys was, it says the surgeon thought dancing operating room videos were funny, but the victim's family isn't laughing. So this is a cosmetic surgeon, a dermatologist that had a patient death recently in Atlanta and maybe some other issues with surgical procedures. You know, Jason, I'm going to start with you. There's a lot to talk about in this, isn't there?
You're right. And we have four of us on, so we can kind of all break this up into different parts. So, you know, let's just start with the fact that she's not a plastic surgeon doing surgical procedures. So let's just start with that. She's advertising herself as a plastic surgeon. Now, bad things can happen in our hands and other people's hands. We've covered some of the problems with buttock fat grafting, Dan, and some deaths with that. So we know that among real plastic surgeons, bad things can happen. But why take the chance to go to someone who's non-board certified, who's not a plastic surgeon, to do an invasive procedure? So I think just starting from that, that's just dead wrong. But otherwise, bad things can happen, and a lot of things went wrong in this case. So I'll start with the not a plastic surgeon doing plastic surgery. First ding. Next.
I think if anyone calls themselves the best, the first, the only, I think that sets up a red flag. And I think patients need to be aware of that. A person who is truly skilled is generally going to be a little bit more humble, and at least the people I share company with would be hesitant to call themselves by those terms. Certainly someone who's not even board certified in the specialty, and then to say that they're the best, that kind of scares me. And when someone uses the term that they're a cosmetic surgeon rather than a plastic surgeon, that's almost like saying, well, I took a weekend course, or I taught myself, I did this because I didn't go through plastic surgery training. I'm not a plastic surgeon, but I want you to think I am a plastic surgeon, so I'm not going to tell you everything you really need to know. The whole thing's just deceptive. It's fraudulent.
This person was a dermatologist. So did dermatologists do surgical training?
Dermatologists aren't trained as surgeons. There are some procedures they do, removing skin lesions. Some of them will do some local anesthetic procedures, small area liposuctions. But this woman on the videos, the other thing she's famous for were these intraoperative music videos. And she was doing surgical procedures where her knife was moving to the beat of the music, and that takes it to a whole nother level of wrong. That in surgery, you are paying attention to your surgery, not entertaining everyone around you. So there are dermatologists who are very well qualified to do procedures, but the level of procedures she was done, also her operating room, I would suspect was not accredited, because in one of the stories they said when they had to call 911, the elevators in her building did not fit a stretcher. So the paramedics had to carry the patient up and down the steps. So it's not only the surgeon, but the place where you're having surgery as well.
I want to cut it similar to Pat. When you're a surgeon in the operating room and your patient's asleep, it is almost as intense as a code. You should be focused on that patient 100%, and your goal is to finish the operation as efficiently as possible to minimize the anesthesia time. And, you know, everything that didn't have to do with that patient care, dancing, singing, gesticulating, is all completely inappropriate. And I think that putting a camera in an operating room for entertainment should be illegal. I don't think an operating room is where entertainment should be sourced. It's a place where surgery should be performed.
How do they do these procedures? Because most of them don't have hospital privileges to do what they're doing, right, in their office ORs.
I mean, I don't understand how some of the people get the guts to embark on some of these things. I mean, some of these are complex surgeries, and you can get into some bleeding from some of these big excisional procedures. I mean, it's a tough case. We sweat every case. Nothing is minor that we do. Every little case, little cyst, stitch by stitch is a millimeter by millimeter surgery. And as I've said before to all you guys, when you're in the operating room, you need to focus, you need to get done efficiently, and you need to really get that patient off the table safely.
Yeah, it's just a shame that this happened to this woman. It's a shame that there's other people that obviously been harmed by this individual. But it gets back to something we talked about before, and my blood boils every time we're having to say this again, but I don't understand why the government has an important role to protect the public. And the regulators and the state boards that handle the medical licensing, they need to do something about this, because if you have people that are not going through the proper training, every one of you guys on this show is educated residents and trained people and done education for many, many years. And you know how long that takes and how many years of training it takes to train a resident. And these are people that are going to weekend courses, or maybe they had 6 months of training but no formal surgical training. It's a joke. None of these people have hospital privileges to do the procedures they're doing in their office. And that is a state, in my opinion, that's a state board issue. The state boards need to take control. They need to say you can't do procedures in your office that you don't have hospital privileges to do. And that would save countless lives. All right, well, let's move on to the next topic, which actually is very related. Is about doing your homework and how to choose a plastic surgeon. And there's an article from one of our major societies, ASPS.
So, I think that this is something that is worthwhile covering over and over again, because this is a question that we keep getting asked on a pretty much daily basis. So, what are the minimum requirements? Okay. Someone for plastic surgery that's completed a plastic surgery residency training program and now has become board certified by the American Board of Plastic Surgery. I think that's the minimum. You all going to agree with that?
Yes.
That's the minimum. But how do you go and figure out who's the expert in X, Y, or Z? And I think that requires a little bit more homework from the patient. I think you need to look on the web. You need to look into that person's credentials. Do they lecture about this? And when you go to a consultation, how many of these procedures does that person actually do? Do they just lecture about it? Whether they actually do this? I read somewhere in one of the books that they were talking about going for a heart transplant. You don't want the university professor who teaches heart transplant, who talks about it all day. You want the guy in the ditches doing heart transplants every day. You want someone who's actually doing these procedures.
I do think reviews can be helpful. So in some ways I'm going to disagree with other people, but I tell my patients when they bring that up, I said, look at the trends. People are on a bell curve. If they have a few bad ones, a few good ones, that's not where it is. Look at from website to website, look at the trends, and we'll give you a little bit better idea about what the public at large thinks about them.
So Pat, give us your insights and also tell us there's confusion from a lot of patients on, is a plastic surgeon the same as a cosmetic surgeon? What's the deal with that?
Yeah, the one thing that you can do is go to the American Board of Plastic Surgery's website, and they actually have a finder where you can put the name of a doctor in and find out whether they're certified by the American Board of Plastic Surgery. A plastic surgeon had general surgery training, certain number of years of plastic surgery training. Now I think the minimum is 6 years of training after medical school. So that training is very different than a cosmetic surgeon. Any doctor can call themselves a cosmetic surgeon. There actually is an American Board of Cosmetic Surgery, but it's not recognized by the American Board of Medical Specialties, which is the only board that recognizes all of the real board certifications. So someone could have a certificate and say they're certified, or you could have a gynecologist, or we had an emergency room physician that was board certified that was doing cosmetic procedures in St. Louis for a while. So you have to ask a surgeon what is their board certification, not just are you board certified.
One guy had his waiting room was the Dunkin' Donuts, and we said that was obviously a easy red flag, but the red flags sometimes are hard to spot, right?
Yeah, I mean, we all are talking about the right thing, but here's a couple of facts. There's something called the Mako effect. You all know what Mako is. It's the worst paint job in the history of American cars, right? But you know that Mako is a highly successful business. Burger King makes really bad food, and so does McDonald's, but they sell billions of hamburgers. Now, how you think that plastic surgeons are going to stop people from buying the cheapest, lowest cost product? I think we're almost as guilty of being stupid as they are of being bad. In other words, there's no amount of education we can give our patients in the exam room. The patients who made it into your exam room, Mark, they're the lucky ones. They made it into your exam room. We're talking about the people you never see. These are the people who go and have, liposuction in a BBL in Colombia for $3,000, who end up coming back in a pine box.
Buyer beware, and patients do need to do their homework, and we can educate all they can, but the patients are going to have to take some ownership. And you know what? If you have a question, you can certainly email the Plastic Surgery Channel, and we'll be happy to research it for you and give you a recommendation, because we're there for the patient. All right, so let's go to our last topic. So this DDV, I'm gonna let you lead off on this one because this is right up your alleyway. But this is an article saying that it's becoming the bikini season, and people need to get their booty facial before they get in their bikini.
My first day of plastic surgery resident, my chief told me the ass is not the face. Mm-hmm. But in reality, it is the face. No, seriously. Look, if you're going to do a $10,000 operation on someone's butt, you might as well take care of their skin too. And there's no question that there are skin issues. There's, seborrhea, there's, all sorts of acne on the butt. So I think the idea is a good one. I think the idea is a good one to provide the service. I think Mark Schulman is a progressive plastic surgeon, and he's a forward thinker. I don't have a problem with it. I think, buttock skin, it's kind of like having a perfect butt, but the skin is not good. So I think it's a good idea. I only have an issue slightly with the name. What is it? Something like tune up the tush. It's a little cheesy, but I think the concept makes perfect sense. It's just like saying, look, if I'm going to do a facelift on you, but not take care of your acne or your melasma, you're not really doing a complete job. So I agree with the concept in general.
Pat, it's not unique necessarily to the buttock, right? We tell patients to take care of their skin and other areas of the body because it just helps their overall appearance.
Yeah, I think it's a good idea. As Dan said, that it sounds a little cheesy, but actually it's very reasonable. I heard someone speak once about, facelift with skincare. They said it's like you put a new mattress on your bed, you get the best stuff, and then the sheet on top is all wrinkled and hasn't been ironed. You want the whole bed to be made and smoothed out so the stuff underneath looks good because of what's covering it. So I think the same thing for any part of the body. The chest for patients having breast augmentation or breast lift, if they have wrinkled skin with discolorations, same thing. There's lots of skin procedures that are done on the chest to help improve that, and I think it's a good idea.
Mark, tune up the tush. What do you think? Delvecchio taught me that.
I think it all comes down to exposure. Whatever part of your body you're exposing to the public. And everyone, it's your face, and some people are concerned about their hands, but as the butt gets more and more public visibility when you're out and about and less clothing, then it totally makes sense, and I'm all for skincare.
JP, you're from the great state of Florida, and all the people in bathing suits. You must know the answer here.
I'm going to give you the answer. You guys are all full of whatever. Okay, I'll be the contrarian to this. So if you listen to any of my laser lectures, okay, so in one of my slides in the laser lecture, I have biopsies of skin from different parts of the body. Which do you think is the area that has the least sun damage and the least wrinkling of all the areas in the body? Probably the buttocks, because it's usually among the least sun exposed. Most of the skin problems we see today are from long-standing UV radiation due to photo damage. So the butt, it's nice to clean up your butt skin. That's usually the last place that people need their skin cleaned up. Usually their face, but gotta tell you, we're doing a ton of off-the-face stuff right now. Décolletés, arms, backs, legs. No one's asked for the buttocks yet, and I have no problem. I've treated skin on the buttocks before, but it's usually an area that's not too damaged. But hey, if you have the money and you want to pay for it, probably can't hurt.
Those are great insights, and I'm sure our viewers really enjoyed it. And if you want to see more of this, you can see it on theplasticsurgerychannel.com.